We need to talk about constipation, and we need to talk about it right now. You might think it's just a bit of discomfort, a temporary inconvenience, but ignoring that feeling of being blocked up, that struggle in the bathroom, can sometimes be like ignoring a warning light on your car's dashboard. It might be something simple, but it could also be hinting at something that needs immediate attention, and letting it go on can lead to a cascade of other problems that steal your energy and your comfort. So many people suffer in silence, thinking it's just a normal part of aging, but it doesn't have to be, and dealing with it promptly is more critical than you might realize. Let's get straight to the bottom of this. Pun intended. When you're feeling backed up and miserable, you need relief, and you need it fast. And beyond that, you need strategies to keep things moving smoothly so you don't end up in that uncomfortable situation again and again. Think of your digestive system like a busy highway system inside your body. Food comes in, nutrients get delivered where they need to go, and the waste products need to exit efficiently. Constipation is like a major traffic jam on that highway. Everything slows down, things get backed up, and nothing moves the way it should. You feel bloated, uncomfortable, maybe even a bit crampy or nauseous. Straining to get things moving is not only frustrating, but can also lead to other issues like hemorrhoids and tiny tears down there. Definitely things we want to avoid. For seniors, chronic constipation can sometimes even affect appetite, energy levels, and overall quality of life. It's not just about the physical discomfort, it's about how it makes you feel day in and day out. So when that traffic jam happens, the first priority is to clear the immediate blockage safely and effectively. What can you do right now when you feel that urgent need to go, but nothing's happened? One of the quickest and most effective things involves changing your position on the toilet. Sounds simple, almost too simple, but it works wonders for many people. Most modern toilets put our bodies in a position that actually kind of kinks the end of our colon, making it harder for waste to pass through. Think of it like trying to get water through a garden hose that has a bend in it. The flow is restricted. Our bodies are naturally designed to squat for elimination. You don't need to actually squat on the floor, thankfully. Just grab a small footstool, a stack of books, or even some sturdy boxes, and place them in front of the toilet. When you sit down, put your feet up on the stool so your knees are raised higher than your hips. This simple change in angle helps to straighten out that final part of your colon, unkinking the hose, so to speak, and allowing waste to pass much more easily. It might feel a bit strange at first, but give it a try. You might be surprised how much difference this posture makes. It encourages your body's natural mechanics to work with you, not against you. Another immediate tactic you can try is a gentle abdominal massage. This isn't about deep, painful pressure. It's about encouraging movement along the path your colon naturally takes. Imagine you're gently trying to coax traffic along that internal highway. Lie down comfortably on your back if possible, perhaps on your bed or a sofa. Using the flat pads of your fingers, start on the lower right side of your abdomen near your hip bone. Apply gentle, steady pressure and move your fingers slowly upwards towards your ribs. Then move across your upper abdomen, just below the ribs, towards your left side. Finally, move downwards on the left side towards your left hip bone. You're essentially tracing the path of your large intestine in a clockwise direction. Do this slow, gentle massage for about 5 to 10 minutes. It can help stimulate the muscles in your intestinal walls and encourage the backed up waste to start moving towards the exit. Think of it as gently nudging things along their intended route. Combine this with deep, slow breathing, which can also help relax your abdominal muscles. Next, don't underestimate the power of warm liquids when you're feeling stuck. While staying hydrated is crucial all the time, drinking something warm can have a particularly helpful effect when you need immediate relief. Think of it like trying to loosen something sticky. Warmth often helps. A cup of warm water, perhaps with a squeeze of lemon, or a mug of herbal tea like peppermint or ginger tea, can be very soothing and stimulating for your digestive system. The warmth helps to relax the muscles in your gut and can encourage bowel contractions known as peristalsis, which is the wave-like motion that pushes waste along. Avoid cold drinks right now, as they can sometimes cause muscles to contract in a less helpful way. Coffee can also stimulate bowel movements for some people due to the caffeine, but be mindful it can also be dehydrating. So follow up with plain water. That warm liquid acts almost like a gentle internal lubricant and wake-up call for your digestive tract. Sometimes a little bit of gentle movement is all it takes to get things going. If you're able, try some light physical activity. This doesn't mean running a marathon, just a simple walk around your house. Or, if possible, a short walk outside can make a difference. Movement helps stimulate the muscles in your intestines. Think about shaking a container gently to get the contents to settle. Gentle activity does something similar for your insides. Even just standing up and doing some gentle stretches, like torso twists or bending side to side, can help. If walking is difficult, try some chair exercises like marching in place while seated or doing leg lifts. The key is just to get your body moving a bit, which encourages your internal systems, including your digestive tract, to become more active too. Avoid strenuous exercise right when you're feeling very blocked, but gentle movement is often beneficial. Now, these immediate strategies are fantastic for getting relief in the moment, like calling a tow truck for that traffic jam. But we also need to think about road maintenance, about how to prevent these jams from happening so frequently in the first place. This is where consistent home remedies and lifestyle adjustments come into play, acting as your long-term plan for keeping that internal highway clear and running smoothly. It requires a bit more patience and consistency, but the payoff in terms of comfort and health is enormous. So let's talk about the absolute cornerstone of preventing constipation: fiber. You hear about it all the time, but what does it actually do? Think of fiber in two main ways. There's insoluble fiber, which acts like a broom sweeping through your intestines. It doesn't dissolve in water, so it adds bulk to your stool and helps push everything through your system more quickly. You find this kind of fiber in things like whole wheat bread, brown rice, nuts, seeds, and the skins of many fruits and vegetables. And then there's soluble fiber, which acts more like a sponge. It absorbs water and forms a gel-like substance, which helps to soften the stool, making it easier to pass. Good sources of soluble fiber include oats, beans, lentils, apples, citrus fruits, carrots, and psyllium husk. You need both types of fiber for optimal bowel health. Prunes are famous for a reason. They contain both fiber and sorbitol, a natural laxative. Aiming for a good mix of fruits, vegetables, whole grains, and legumes every day is crucial. It might seem daunting, but start small. Add a piece of fruit to your breakfast, switch to whole wheat bread for your sandwich, have a side of beans with your dinner. Gradually increasing your fiber intake gives your system time to adjust. I think of it as slowly building up the maintenance crew for your internal highway. In fact, numerous studies involving large groups of people have consistently shown that those who eat diets rich in various types of fiber tend to experience constipation far less often than those who don't. It's one of the most well-established links in digestive health research. More fiber generally means smoother sailing. Now, there's an important caveat to adding fiber to your diet that I must tell you about. Hand in hand with fiber goes hydration. Fiber needs water to do its job properly, especially that soluble fiber sponge. If you increase your fiber intake without increasing your fluids, you can actually make constipation worse. It's like adding more cars to the highway without ensuring the road surface is smooth. Things can get even more jammed up. You need enough water to keep the stool soft and bulky, allowing it to move easily. But how much water is enough? It varies from person to person, but a general guideline is to aim for around 6 to 8 glasses of fluids per day. Water is best, but herbal teas, clear broths, and even watery fruits and vegetables like cucumber and watermelon contribute to your total intake. Pay attention to your body's signals. If your urine is consistently dark yellow, you're likely not drinking enough. Feeling thirsty is also a sign you're already starting to get dehydrated. Keep a water bottle handy throughout the day and sip on it regularly rather than trying to gulp down large amounts all at once. Think of water as the essential element that keeps the river of your digestive system flowing freely. Without enough water, things become sluggish and stagnant. Regular physical activity is another key player in preventing constipation. We already mentioned gentle movement for immediate relief, but consistent, moderate exercise most days of the week helps keep your digestive system toned and active. Exercise helps decrease the time it takes for food to move through the large intestine, limiting the amount of water absorbed from the stool and thus keeping it softer. It also helps stimulate the natural contractions of your intestinal muscles. Again, this doesn't require intense workouts. Aim for about 30 minutes of moderate activity like brisk walking, swimming, dancing, gardening, or even more vigorous house cleaning. Find activities you enjoy so you're more likely to stick with them. Think of exercise as a regular tune-up for your body's engine, ensuring all parts, including the digestive system, are working efficiently. Even simple chair exercises, if mobility is limited, can contribute positively. Consistency is more important than intensity here. Have you heard about probiotics? These are the good bacteria that live in your gut and play a vital role in digestion and overall health. Sometimes the balance of bacteria in our gut can get thrown off, perhaps due to illness, medication like antibiotics or diet. And this imbalance can contribute to digestive issues, including constipation. Introducing more beneficial bacteria can help restore that balance. Think of it like bringing in more skilled workers to help manage the traffic flow on our internal highway. You can get probiotics from fermented foods like yogurt. Look for live and active cultures on the label, kefir or kefir if you prefer, sauerkraut, kimchi, and miso as well. There are also probiotic supplements available, but it's a good idea to talk to your doctor before starting any new supplement, as they can guide you on the right type and dosage for your specific needs. Some research, while still evolving, suggests that certain strains of probiotics may help improve bowel regularity and ease constipation symptoms for some individuals. Scientists have observed in various studies that these friendly microbes seem to help regulate transit time, essentially how long it takes for waste to move through the system. Another nutrient that can be helpful is magnesium. Magnesium plays many roles in the body, including muscle function. In the context of constipation, it helps by relaxing the muscles in the walls of your intestines. Many people don't get enough magnesium through their diet. Good food sources include leafy green vegetables like spinach, nuts like almonds and cashews, seeds including pumpkin seeds or chia seeds, legumes, and whole grains. If you're considering a magnesium supplement such as magnesium citrate or oxide, which are often used for constipation, it is absolutely essential to talk to your doctor first. Too much magnesium can cause diarrhea and cramping, and it can interfere with certain medications or be risky for people with kidney problems. Your doctor can advise if it's appropriate and safe for you. Establishing a regular routine for bowel movements can also be surprisingly effective. Your body often thrives on routine. Try to set aside a specific time each day to sit on the toilet for about 10 or 15 minutes without distractions such as after breakfast or another meal when the colon is naturally more active. Don't strain or force things, just relax. Even if you don't have a bowel movement every time, this practice helps train your body and can encourage regularity over time. It's like setting an internal alarm clock for your bowels. Pay attention to your body's signals too. When you feel the urge to go, try to honor it as soon as possible. Ignoring the urge repeatedly can make constipation worse over time as the stool sits longer in the colon and becomes harder and drier. Don't discount the impact of stress on your digestion. When you're stressed or anxious, your body goes into fight or flight mode, which can slow down digestion as your body diverts energy to other areas. Chronic stress can definitely contribute to chronic constipation. Think of how your shoulders tense up when you're stressed. Something similar can happen internally. Finding ways to manage stress is important for your overall health, including your gut health. This could involve gentle exercise, spending time in nature, listening to calming music, practicing deep breathing exercises, meditation, or engaging in hobbies you enjoy. Even taking a few minutes each day to consciously relax can make a difference. And this is one that a lot of people miss. It's really important you consider your medications. Many common medications, both prescription and over-the-counter, can have constipation as a side effect. This includes certain pain relievers, especially opioids, antidepressants, antihistamines, blood pressure medications like calcium channel blockers, iron supplements, and antacids containing aluminum or calcium. If you've recently started a new medication and noticed constipation starting around the same time, or if you're struggling with chronic constipation and take regular medications, have a conversation with your doctor or pharmacist. They can review your medication list and see if any adjustments can be made, perhaps switching to a different medication or suggesting strategies to counteract the constipating effects. Never stop or change your medication dosage without consulting your healthcare provider. While these home remedies and strategies are effective for most cases of occasional or mild chronic constipation, it's crucial to know when to seek medical advice. Please don't hesitate to contact your doctor if you experience severe abdominal pain. See blood in your stool, which can look like bright red blood or dark, tarry stools, have unexplained weight loss, or if your constipation is a sudden change from your normal bowel habits and lasts for more than a couple of weeks despite trying home care measures. These could be signs of a more serious underlying condition that needs proper diagnosis and treatment. Dealing with constipation isn't just about finding quick fixes, it's about adopting a long-term approach to support your digestive health. You can dive deeper into gut health in this next video.